Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on signs and symptoms. Even though at the starting of the disease or initial part of the disease, there is no specific signs and symptoms. This can be vague, this can be any symptom. But as the disease progresses, this can be consolidated to few symptoms. First one is dementia. Dementia means the patient is going to forget where he is. He is going to forget the things that has happened in the past. He is going to forget the things that are happened recently. He forgets everything. He forgets to button his dress. He forgot to sleep. He forgot to wake up. He forgot to eat. So lot of dementia, loss of memory is the hallmark of this disease. And next one is myoclonus. Myoclonus is involuntary jerking movements of the hands. He will jerk his hands involuntarily and the movements are sudden. Next one is extrapyramidal symptoms or pyramidal symptoms. In this you can see the symptoms such as what you see in Parkinson's disease. There will be dancing symptoms, there will be tremors, there will be shuffling gait. Lot of symptoms related to Parkinson's disease can be seen here. And next one is cognitive symptoms. What happens here is he will lose the reasoning for a particular thing. He cannot think properly, he cannot judge, he cannot understand. Lots of cognitive things are hampered in this disease. Next one is behavioral. Lot of behavioral changes can occur, like he can become violent, he can become sad, he can become suspicious, he can become depressed. Lot of behavioral changes can be seen in this disease. Next one is ataxia. Ataxia means loss of balance. He is not able to walk properly. He may fall down, or lack of coordination between the movements. If he tries to eat something, he is not able to keep that in his mouth. Lack of balance, or lot of things related to coordination and balance are missing for this patient. Sensory symptoms include visual hallucinations, means he will be visualizing something which is not in front of his eyes, or he can hear some voices, or he can have different taste in his mouth which are not there in his mouth. So lot of sensory symptoms or sensory hallucinations will be present in this disease. Next one is akinetic mutism. In this patient completely loss of speech and cannot speak. His limbs become rigid, so tight, and he goes into coma. Finally, the patient dies because of pneumonia. Pneumonia is the reason for final death of this patient within 1 year. And coming to the investigations, first investigation that has to be done is ECG. ECG is the recording of electrical activity of the brain. There are certain ECG findings. With that, you can infer that this is Creutzfeldt-Jakob disease. Next one is MRI. MRI is also very good. Here what happens is there will be degenerative changes seen in the brain. Next one is tapping of cerebrospinal fluid. This fluid is sent for biomarkers. In that fluid you can see that biomarkers for this disease. And the definite and final test you have to do for this disease, and this is specific for this disease, is RT-Quick. This is a specific test for this disease. If you perform this test, you can 100% or mostly you can diagnose that this is Creutzfeldt-Jakob disease or abnormal prion disease.